Good morning, Hood County. My name is Ashley, and this is your Community Health Watch. So, today we're going to be diving into a very real, very relevant issue here in Hood County, and that's going to be sexually transmitted infections, or STIs. And I know what you might be thinking. STIs? At breakfast? Well, I'm here to tell you that this is going to be a conversation that you need to hear. So go ahead and settle in with your coffee or your cereal this morning, and I hope that you enjoy us dive into the background of STIs, the community resources that are going to be available to you, the population that we feel like this is going to be benefiting, the interventions and activities that we're planning on implementing, the funding that's going to help us along the way, and the community involvement that we hope to involve you in. And then lastly, our call to action. So without further ado this morning, we're going to dive in and I'm going to turn it over to our reporters.
Hi, I'm Heidi. Did you know, according to the county health rankings, STI rates in Hood County have steadily climbed over the last decade? In particular, chlamydia cases have been overpopulating not only the youth, but the young adults as well. Now, ladies and gents, it's time to get educated on the resources available. Here's Amy to tell you more. Amy, over to you.
Thanks, Dr. Heidi. That was some really great information. Hi, guys. My name is Amy. I'm part of the newscast here. So what we're going to talk about today is a little bit more of the STD dynamics. So we have to really understand that it's not just people our age catching STDs. What we've learned over time is that it's not only the young that's catching the STDs, it's the old as well.
Thankfully, Hood County isn't without help.
Resources. You can get help at your local health department, Planned Parenthood, places that you can get help that we've even been to before, like Lakeside Physician's Office. Now, if you're afraid to actually go in person, there's some online sources that you can use, and one is Get Tested. Thanks, everybody. I'm going to go ahead and pass.
And don't forget schools, churches, and CrossFit gyms. Yes, even gyms are great places for pop-up health education.
So what is the largest age group that's affected? That's going to be our teens to young adults, about 15 to 25. This is where this group normally starts getting sexually active. And why is this age group so affected? Well, we think that it's because the lack of sexual education in schools, the lack of STI testing, and just overall the limited access to contraceptions, such as condoms and dental dams. So this age group also faces a lot of judgment and shame around STIs and sexuality in general. So we see a lot of this age group, a lot of these people who don't get help or seek further education, which of course causes larger outbreaks.
Hi, my name is Julie and I'm here to provide you with a few statistics. The biggest age group affected with STIs are ages 15 to 24. Although this age group is most common to get an STI, this project isn't just for them. It's for the people with no health insurance, people who live in rural areas, and people who just feel embarrassed. Our message, shame-free, fact-forward. Due to the lack of insurance, people aren't going to get regular checkups, especially for a sexually transmitted infection. Most of the community that doesn't have insurance or get these checkups may not even be aware that they have contracted an STI. 14% of Hood County alone is without health insurance, which is 3 points lower than the state as a whole. It is reported that 1 in 5 people in the U.S. have contracted an STI. Can you imagine the amount unreported?
Hello, my name is Amy and I'm joining you all live today from Hood County, Texas. I wanted to join and speak about some of the activities and interactions available here in Hood County, Texas to address sexually transmitted infections, also known as STIs. The Hood County Health Department plays an important role offering not only affordable but confidential testing and counseling. This helps people know their status and allows them to get treatment early, which helps reduce the spread of infection. Education is a key intervention. Local health departments, schools, and community groups often hold educational sessions which educate about safe sex practices. For more information, follow our link below. Thank you.
This summer. So wow, that was a mouthful, okay? But we know that even with all of these good programs that we have in place, that it's still not enough. We're still seeing lots of this entering our facilities, our clinics, our ERs, our schools. It's in our everyday life. So we have implemented in our community the Seek Care Not Fear program. Basically, what this program is just making more awareness. One of the problems that a lot of people have is they just don't know where to go. They don't know where they can and can't get help. So we have started this QR code. It will be placed in different areas that are more high-risk areas. It will also be visiting our high schools and schools to be able to make awareness to our teenagers. This is a program that is already pretty much out there. This is kind of like a on wheels clinic. It can go to different facilities. This QR code that we have, when you scan it, it will tell you where that clinic is going to be on those certain days. It also has a privacy feature where if you want to make an appointment, they can come to you. So we feel like this is going to help get the word out about what our community offers and make it more readily available to everybody so we can get this under control. We want people to know where they are, where they can get their knowledge, what their status is, so we can help to try to eliminate this as much as we possibly can.
Funding? We got you. Grants from the HRSA, the CDC, and state agencies are available for exactly this kind of work. The Centers for Disease Control and Prevention specifically allocates funds to help prevent and control sexually transmitted infections. This money supports local health departments by helping them monitor cases, provide on-the-ground prevention, promote testing and treatment, and increase public awareness.
The breakdown. According to the Texas Department of State Health Services, DSHS, HIV and STI prevention grants are funded through annual federal grant awards from the CDC and Health Resources and Services Administration, HRSA, and are contingent upon congressional and Texas legislative support. Competitive grants are open to governmental, public, or private, nonprofit entities located in Texas, including city and county health departments, community-based organizations, and public or private hospitals. Locally, we can also rally support from small businesses, clinics, and churches. Imagine a bake sale with cupcakes shaped like, well, educational anatomy.
How would the community be involved? Community involvement is a cornerstone of any successful public health intervention. For Hood County, addressing the increasing rates of STIs, particularly chlamydia, as shown in the STI trend chart, is essential. While the county fares better than the state average in many health conditions, the specific measure has been getting worse and signals a critical area of concern.
To effectively tackle this issue, the community can be involved in several evidence-based and impactful ways. Community-based education and vaccination programs, engaging local organizations, schools, and clinics, and community-based HPV vaccinations campaigns is a proven method for reducing STI transmission. These programs improve vaccine uptake by delivering services in familiar, accessible environments.
Peer-led and youth group focused programs, collaborating with vocational schools, sports programs, and youth centers to implement STI education integrated with vocational or recreational activities can build trust and increase engagement among adolescents and young adults, a high-risk group for STIs. These programs can involve peer educators and community health.
School and parent engagement, involving parents, educators, and school boards in comprehensive sexual education planning ensures cultural sensitivity, accuracy, and local buy-in. Hood County's performance on population health and community conditions, as shown in the graphics, suggests strong foundational support for such programs. And social marketing campaigns. Launching local mass media campaigns featuring relatable content, local voices, and clear calls to action can raise awareness, reduce stigma around STI prevention testing and treatment. This also includes digital engagement through school newsletters, community Facebook groups, and clinic websites.
Getting tested doesn't mean that you're guilty of something. It means you're smart. Protect your partner, protect yourself. It's all confidential, it's fast, and yes, it's available right here in Hood County. Today we learned that with the right knowledge and the right tools, we can face any public health challenge. STI rates may be rising, but so is our awareness, and that makes all of the difference. Today we learned that with the right...
Community Health Watch, thanks for tuning in and watching. Remember, be safe, be smart, and we'll see you later, Hood County. For all of us here at Community...
Hi, my name is Julie, and I'm here to provide you with a few statistics. The biggest...
I'm going.
Yeah.
Jesus Murphy.
Old as well. Yeah, that's right. The old people are catching STD. It's the old as well. Yeah, that's right. The old people are catching STD. Old people are catching STD.
Funding? We got.
Imagine a bake sale with cupcakes shaped like, well, educational anatomy.
Testing and treatment.
Addressing the increasing rate of STIs is essential. While the country...
Mass media and social marketing campaigns. Launching low...
A mouthful, okay? But a mouthful, okay? A mouthful.
Thank you, Dr. Heidi. Well, hello, guys. My name is Amy. And